This is an image challenge from the NEJM. A 55-year-old man with metastatic squamous cell lung cancer presented to the hospital with a 6-week history of pain and swelling of the right great toe and tip of the right middle finger. He reported no history of fever. On physical examination, swelling and erythema of the distal phalanx of the right third finger and right great toe. There was also an area of ulceration adjacent to the great toenail. The lesions were firm and tender to palpation. Radiographs of the hands and feet were taken. What is the most likely underlying cause of the findings? The answer is acrometastases. Acrometastasis is an exceptionally rare form of metastatic cancer spread, accounting for only about 0.1% of all cases. It is most commonly associated with lung cancer, which serves as the primary source for many instances. This condition involves the spread of cancer to distal areas of the body, particularly the fingers and toes, which is distinct from typical metastatic patterns that usually favor regions rich in red bone marrow. In general, lung adenocarcinoma, the most prevalent lung cancer type in many regions, is strongly linked to smoking and typically metastasizes to areas such as the vertebral bodies. In contrast, acrometastasis affects extremities, with finger lesions most often linked to lung cancer and toe lesions usually stemming from genitourinary cancers. The distal phalanx, especially the thumb, is frequently the site of hand metastases. The underlying mechanisms of acrometastasis are not fully understood, but likely involve circulatory factors. Lung cancer predominates in these cases because other solid tumors often become trapped in the hepatic or pulmonary capillary beds. Various theories have been proposed, including the possibility of increased blood flow to dominant hands, repetitive trauma that may facilitate tumor emboli, and the role of trauma-induced prostaglandins as chemotactic agents. Clinically, diagnosing acrometastasis can be challenging, as it may mimic inflammatory conditions such as osteomyelitis, cysts, gout, or primary skin tumors. Treatment options often include amputation for lesions in the distal phalanx, although alternative approaches such as radiation therapy or bone cement may be considered to preserve function. The prognosis for patients with acrometastasis is generally poor, with average survival typically under 6 months, highlighting the importance of maintaining a high index of suspicion in patients, especially those with a history of smoking, who present with unexplained pain in the digits.